Well, thank you for the opportunity to speak about the support that mainly this seminar is about, obviously raising awareness of mental health. But in raising that awareness, the question is raised as to not only are we raising it, but once we raise it, what do we do to support people to actually run businesses better? You know, if they're construction workers, how can we support construction workers to make the life of running a business in construction or in building or working in construction better, so that that component in terms of administrative, legal, accounting services are, you know, taken care of, therefore placing less stress on them to actually so that they can free up their time to do find support in other areas. So for me, I think being the CEO of VGI, and obviously for Nick, who runs Verity Business Hub, we offer an ecosystem to support SMEs, so small to medium enterprises. I myself, I have a husband who owns a building business. He's very much aware of what's going on in the industry, both in his employee level, as in construction workers that actually work in construction, and also in running a small size building and construction business. The supply chains are an issue. Price of materials have gone up, sometimes 30 to 40%, okay? We have a labour shortage unheard of in the last 100 years, okay? In a once in a century pandemic, right? But where he inspires me is that he does reach out to support, for that support. We help him through administrative work. So he's on the low tech end. So he's more of a mature age person who owns a construction business. So his technology skills may not be as proficient as someone that is of a younger generation. So things like operating Xero, which is the accounting software that assist a business owner to operate their business, becomes a difficulty for him. Doing bookkeeping, when you're balancing both, you know, delivering a job on time in the quality and standards that he would expect for, you know, according to standards in Australia, we all know how stressful that can be. So when you've put in a full day of, I guess, laborious work, the last thing on your mind would be to roll out the bookkeeping and do some bookkeeping. So Verity Business Hub helps my husband do his bookkeeping and also run the administrative tool and the accounting and management tools that will help him to run his business. So this is where I mean, we can go through all the data, and I've written quite a bit about the data in mental health in construction. I will distribute this, you know, so that everyone can see, but we can see 1 in 5 construction workers live with mental health challenges, and this is increasing every day. It will increase even more. I foresee that it will increase even more in the times coming up when inflation is high and the cost of labour is rising for small business owners who are in construction. So I think, and I take, you know, Jim's word in that it is a very, there is very high stigma against men and mental health, and it is increasingly, whilst it is increasingly, there are females coming into the profession in the construction industry. It is very much has been a male-dominated industry. So I think it will change in that as more females get in and there's more awareness around mental health. But I think at the moment, with the state of it being a male-dominated industry, we do find that there's a high stigma against reaching out for help for mental health. Can we go back to the slide? Yep. Suicide rates in construction industries are twice as high as the national average. Men die suicide at the rate of 3.5 times more than women. Sad statistics. However, it is a reality in this construction industry. So where are the top 5 causes of burnout in the construction industry? There's unfair treatment at work, unmanageable workload. Jim has just addressed the fact that it is a high-stressed environment where things can go wrong. Lack of role clarity. You know, you're an apprentice putting in, you know, hours to get your experience, but then sometimes you're asked to do things that are outside the scope of your roles. So there is that lack of clarity, lack of communication and support from managers, and unreasonable time pressures. I think going to 4, a lot of, from my experience in observing my husband, he runs a very busy construction practice, and it's not that he isn't there to support his staff, but due to the labour shortages, he's just spreading himself so thin over different areas of managing that business. And it doesn't mean not to be there to support, okay? But we try our best to try and have that support for the younger construction workers, but one would expect that the older ones who've had more experience are able to pretty much be on their own. But what he's seeing in his team is that the older the construction workers are, the less likely they're actually going to reach out for help. The younger apprentices are the ones that are much more aware of, you know, mental health, and they're able to reach out a lot better than the older generation workers that he has on his team. So I wanted to point out 4 because that's my own experience from observing my husband's business. 3 in 10 suffer signs of depression. 1 in 3 suffer from stress. Almost 1 in 4 suffer from signs of burnout. 1 in 3 suffer from anxiety. These are the signs, I think, of mental health. Can we try and take that? Yep. Thank you. Yeah. So in the past year, 1 in 5 construction workers have been impacted by burning out in the workplace. Over half of workers here have suffered from mental health issues, and only 1 in 6 said there was any sufficient support from employers for mental health. It's an industry that there's always constant activities happening. And in order to meet deadlines of projects for owners of homes and for project deadlines, there are obviously higher impacts on deadlines in the sense that there are penalty clauses of the likes. So therefore, it is a very high impact and a high stress environment. So those statistics are unsurprising to me. Yeah. So we've got some more data, and here it goes to how employees, we've taken some data, and it talks about how employees what could we do to make employees feel like they are more supported in the workplace. So 56% say they want more confidentiality for issues raised. That's a very obviously alarming high statistics. But you have to understand that it's a very collegial male environment. Therefore, you know, they want some more confidentiality around issues raised. Health days for personal well-being, 44%. HR teams to deal with issues quicker, 39%. Greater flexibility in working hours. Whilst we may want this, there are only many daylight hours in the construction industry. They start their days often very early, sometimes 5, sometimes 6, but then they do finish their days a lot earlier. So whilst they may want that, I think it would be hard for actual laborious construction workers But I think in terms of the back house, which is your supporting in the administrative space in construction work, then maybe perhaps that might be a possibility. Manage on-site barriers, banter, which has become bullying. So yes, I see this a lot. Like I said, it's a very collegial male environment. Therefore, you know, that definitely needs to be managed better, which then doesn't escalate to something like workplace bullying. Greater allowance for time off work if you're dealing with a mental health issue. 28% think that should be better. Tighter health and safety measures in difficult environments. Reducing overworking or long hours. There was 28% who felt that there was sufficient support there should be sufficient support from employers for mental health. More financial, 22% say that more financial advice or security in construction work. Therapist sessions and mental health support, 17% say that they would feel more supported, and more professional medical support at 11%. So I guess, you know, what these data basically show me is that there is a spectrum of how an employee in a construction environment would be made to feel more supported. And I think where it says more financial advice and security, there's a lot of construction workers who don't really like bookkeeping, doing all the paperwork and the administrative work. And I guess that's where VBH comes in to support construction workers and small business owners who run construction businesses, building businesses. So how do we start to actually take away some of this? How do we address some of this to make it more better for a construction worker? So there is 3 ways. Make a commitment to make mental health more aware in the construction workplace. Employers and employees checking in regularly to talk and become aware of where they're sort of at the signs of a burnout or at the signs where they're actually suffering some form of mental condition. And then for workplace to be providing more mental health and wellbeing training, reducing stigma, increasing awareness, making a commitment to make mental health more relevant in the workplace, especially in the construction workplace, supporting employees who do have mental health conditions or have are in their journey to sort of reduce burnout, building core skills and confidence to cope with burnout, stress, you know, extra workload, and more education on workplace bullying in the construction sphere. Yeah. So this leads me to our last few slides. As I indicated before, Verity Business Hub have teamed up with Mental Health Foundation to provide initially an environment where basically people that run construction or building businesses can leverage off an ecosystem of support of accounting, legal, administrative support that will allow the actual business owner or free up their time in some way so they can support their construction employees better. That's for the employer. In terms of the employee, where Verity Business Hub can support is they can do your personal tax return, your financial or tax advice that will help a construction worker to plan out their budgets or their cash flow better, so that they're not in a situation where, you know, they're, you know, hand-to-mouth kind of sort of environment. As we know, a lot of young construction workers are, you know, putting themselves in. A lot of them are, you know, living from paycheck to paycheck sort of situation. We don't want them to be that. We want them to be able to plan out their finances better, have a financial plan where if they're doing their tax returns to actually afford homes and afford, you know, to buy their first home. A lot of these young construction workers, I can see some are obviously very attuned to their finances, but quite young apprentices, we find that the lack of skills or understanding or knowledge in that financial area is where they're living from paycheck to paycheck environment. So for the construction building business, SMEs or construction businesses, we do have, if you're starting a new construction business, you don't have to take on a huge lease, you know, you don't have to, you know, have a service, you don't have to take on a huge lease to open your business. Perhaps for the first 6 months, we offer an environment where you can use a registered serviced office. And in that serviced office environment is where you get all your support, your accounting, your legal, your bookkeeping support and your IT support. And then for the construction workers, if you need to come and get financial advice, plan out your cash flow, map out how you can sort of have better cash flow, we have consultants there that can assist a construction worker, particularly young apprentices, to actually foresee into the future and see how they can plan out their cash flow better. And that's the support service that Verity Business Hub commits to with the Mental Health Foundation. And we specialise in just supporting entrepreneurs and SMEs to run their businesses better so that they're there to support their employees in the construction industry. Yeah, thank you. There are some incentives as well. I'll distribute, if anyone wants to distribute this PowerPoint around, there are some incentives that will allow people to start their business or operate as a sole trader or operate as a company in a much more, you know, efficient way, cost efficient as well as administratively efficient way. So we can certainly offer that as a collaboration between Mental Health Foundation tonight. Yeah, and moving forward. Thank you. Yeah.
Thank you, Shanice, for your support. I would now like to invite the distinguished Professor Helen Lingard, Professor in Construction Health and Safety and the Director of the Centre for Construction Work Health and Safety Research at RMIT University, to deliver a presentation. Please join me in welcoming Professor Lingard.
Thank you. Thank you very much, and thank you for inviting me to speak today. I'm very grateful for the opportunity. So today's presentation is about construction workers' mental health, and in particular, I want to talk about some of the things that affect construction workers' mental health, and some of those have already been mentioned, so I think this follows on really nicely from the previous presentation. So it's often stated that working in projects is inherently stressful because working in projects involves timelines, it involves delivering a certain product within a fixed budget and within often a quite tight timeline. However, working in projects doesn't have to be stressful. It can be highly motivating and very rewarding. And so harmful levels of work stress, I would argue, are not actually endemic to project-based work. And I think we need to sort of move away from a lot of the work that's done that says projects are inherently stressful, because they're not, if they're managed well and if stressors are adequately dealt with. So just a bit of, by way of background information, in 2019, some colleagues and I were invited to put a submission to the Australian Government Productivity Commission's then draft report on mental health. And in order to prepare for this, we actually interviewed industry leaders. We interviewed 9 CEOs and senior government people and asked them what it was like working in the industry. And the things that they told us were really quite telling. So here's some quotes. We've seen on the projects, people have mental health episodes as a result of extreme pressures of the job. We've got people saying that sites are characterised by pressure in the industry, people are working long hours. this bottom one, it's not okay to say I'm not okay. It's just not acceptable. Take a teaspoon of concrete and harden up, suck it up, princess. This is the mentality that these CEOs said is pervasive in the industry. And as a result of that culture, a culture industry construction industry culture task force was established to try and change the way that the industry operates and try and change some of these high pressure, long hours, masculine work culture type characteristics. This is a quote from the chair of the construction industry culture task force, who talks about the macho culture, the male dominance of the industry, the long hours, including Saturday work, makes it very difficult for women who are carers of children to see themselves in the industry context. And she also talked about the people being regarded as weak if they talk about mental illness or if they disclose fallibility. And you know, that includes people who might want flexible hours, might want to see their children play sport, and all those sorts of things. So the industry has a culture problem, is one of the questions I'll pose. You know, is this a culture problem? And if so, what might be done about it? And work in this space by the Construction Industry Culture Task Force is ongoing. But a little bit of information about the long work hours. So people in construction work long hours, and this is a piece of research we did a long time ago. We asked people how many hours they worked. People working on site in direct construction activity, on average, said they worked 63 hours a week. In the site office, it was 56, and in the company corporate office, it was 49. There's been a piece of work done by the Australian National University that's actually shown that across the Australian population, men and women of all different ages, working 39 hours a week is actually the tipping point beyond which Australian workers experience a decline in their mental health. And so we look at this and we think, well, okay, over 90 years ago, the International Labour Organization established a weekly threshold of 48 hours a week to protect workers' health. That was at a time when there weren't so many women in the workforce. And so we're now in a different era. We've moved on from that time. And it appears in this most recent work that was done in Australia at the Australian National University that 39 hours is in fact that tipping point. And we can see that workers in construction are routinely, whatever their role is, working more than that. What's more, that there was in fact a gendered element to this, because in fact in that ANU research they discovered that in fact the tipping point for women was actually 34 hours a week, not 39. The reason for that is that women still undertake more care and domestic work, so they have a lower tipping point, which is entirely explained by the unpaid time that they spend doing domestic work. The other point about working in construction projects is that every day isn't the same. So here's some data that we collected on a large construction project over a period of quite a number of weeks. And you can see at around week 13, 14, so sort of here, work hours increased dramatically in the period leading up to this major project milestone. And at the same time as work hours increased during this period, you can see here people's ability to do the work that they needed to do at home and to their satisfaction with their work-life balance actually almost a mirror image declined. And during this time, people were telling us things like, I worked a 10-hour shift on Thursday night after an 8.5-hour shift the day before with only 2 hours of light sleep in between. Back at work Friday for a day shift, started the night shift until 9 p.m. There were lots of essential works to do. I'll be on night shift again tomorrow and I'm feeling really tired and I have little energy. I've been a bit sick for 2 days, but I still went to work because there's just too much going on. I couldn't miss it. I'm not sleeping very well. I just feel very tired. So people were giving us this information in these diaries that really sort of told a story about how damaging this period was in the lead up to this major deliverable that they had to achieve. And you can see in that time frame the negative consequences on people's life outside of work were quite dramatic. And people were saying to us, look, I've got too much to do. There's not enough hours in the week. Time flies by and you come in at 4 in the morning to try and get ahead. So when people are working like this and expending so much effort, physical and psychological effort, and don't have enough time to recover between shifts, then more effort has to be expended the next day to achieve the same amount of work. And over time, that's not sustainable and will have health consequences. Another piece of work that we've done relatively recently is looking at the issue of job quality and mental health in the construction industry. And we analysed a data set from the household income and labour dynamics in Australia data set. And we looked at 15 waves of the Hilda data between 2005 and 2019. And we looked at the job characteristics that are related to mental health in the construction industry. And we specifically focused on construction workers who are not managerial or professional. So this is all if you like manual or non-managerial construction workers. And we found that the things that are in fact affecting these workers' mental health actually vary according to their age group. So for young workers, low job security and unfairness of effort and reward were the two things that affected them significantly. But for middle-aged workers and for older workers, they were also affected by low job security and also affected by unfairness of effort and reward. But they were also adversely affected by high job demands and complexity and high job intensity. So you can see that there's a bit of there's age differences here that do need to be taken into consideration when thinking about what affects people's mental health in the construction industry. And this is from the same data set, and it actually shows the number of adverse job conditions that people were exposed to. So there's adverse job conditions on the previous slide: job demands and complexity, low job security, unfairness of effort and reward, and high job intensity. And you can see here that as the number of adverse job conditions increases, mental health actually declines. But what's interesting about this particular graph is the red line, which shows that the age group 25 to 45, when they have more than one adverse job condition and they get to 2 and 3, the line steepens. So their mental health is affected more significantly or to a greater extent by multiple adverse job conditions than the other age groups. And we don't really know why this is, except that they're mid-aged workers who potentially could have other duties at home, family responsibilities, and so on. So there's something about this life stage that makes them particularly vulnerable to the combination of multiple job adversities. Next, I'd like to talk a little bit about bodily pain, workability, and mental health, because construction work is really physical, and often workers experience bodily pain, often at a very young age. So 29% of construction workers in their 20s in a study that we undertook indicated that they experience upper back or neck pain a couple of times a month, and 18% said they had it a couple of times a week. So these are in their 20s and they're having upper back and neck pain at that level. By the time they're in their 30s, 33% said they had experienced back or neck pain a couple of times a week. And this is the bit that's important here. Workers whose pain originated from work had a significantly higher level of depression severity than others in the sample. People were also, when we interviewed them, really concerned about their future ability to work and the financial impacts that might have for them. And here's a very tragic quotation from one of the people we interviewed. This is a young scaffolder who told us that his friend had passed away. He'd died by suicide not long ago. In fact, it was very, we interviewed him shortly after this. He said his friend had back pain. He struggled to get back to work. When someone has an injury, they go away, they get it fixed, they have time off. They're told to come back maybe 1 or 2 days, but they're too sore to be working, and they feel useless. And then it makes them more depressed, and you start to get into a slump of not doing anything, not being active, and not seeing your friends every day at work. So the consequences of this bodily pain and the effect of bodily pain on mental health are really quite severe. I'd like to mention a couple of really at-risk groups that in the research it suggests that there are some groups that are particularly at risk of mental ill health in the construction industry, and young workers are one such group. So they are reported to experience higher levels of psychological distress than other Australians their age. Apprentices have high levels of suicidal ideation, often linked to hostility and bullying. And young construction workers are more than twice as likely to die by suicide than other young men their age. Women are another high-risk group in the construction industry, although they're not very well represented. They are at high risk of poor mental health. So we know that mental health of women is in construction is worse than for men in construction. They frequently experience sexual objectification, unwanted physical contact, and other forms of gender-based harm. And their minority status exposes them to risk factors over time that has a cumulative dose effect impact on their mental health. In the midst of all this, supervision is important and, supervision and a positive workplace environment is really important. And I'll give you an example of workplace humour. The previous speaker spoke about banter, and how banter can work in the construction industry. And we've recently interviewed a lot of apprentices about their experiences in the construction industry. And this is a quote from a woman carpentry apprentice, age 18. She said, if you don't have a sense of humour with the boys in this industry, you generally won't get on with them. It was about female sexual jokes, all of that. They sometimes hurt you, like they rattle you in a way. So she's affected by this. But at the same time, you're going to hear this for the rest of your life from other people because I'm a female, like saying, you stupid bitch, or like calling me the C word, like nothing too bad, like not to the point where it's like racist or discriminative or anything. These are her words. And that, I think this just speaks to quite how normalised this kind of experience is for these people, and potentially how damaging that is if that's the way that they're spoken to at work. Within that, supervisors and supportive supervision is really important, and the research shows this. We know that positive communication between workers and supervisors supports young workers' mental health and well-being, and that's fairly well documented. One of the pieces of work that we're currently working on is actually looking at what constitutes good supervision and what constitutes good communication between supervisors and apprentices. And after a lot of interviews with apprentices and their supervisors, we've come up with this model that sort of talks about the things that we would like to see apprentices being: assertive, having good work health and safety knowledge, having confidence and emotional intelligence. We'd like to see supervisors being empathetic, approachable, having clear health and safety messaging, being participative and responsive, using good listening skills and emotional intelligence. And with those, you start to get really good positive interactions that are characterised by respect and civility, where there are boundaries that are established and maintained, and where communication is supportive and non-judgmental, and where humour is positive and not aggressive. And with that in mind, we've taken this model and we've developed a role play game, which is a digital role play game called Conversations About Life, Health and Safety. This is based on the lived experiences of construction apprentices and their supervisors. So it's drawn directly from the stories that people told us when we interviewed them. And it's a game that you can play. It's web-based. It's on a mobile phone, and we're trialing it at the moment. But it seems to be going very well. And the preliminary findings suggest that people who've played the game feel better able to communicate, raise issues, and talk about things in the workplace. And supervisors who've played the game talk about how it gave them a degree of empathy, and they could put themselves in the shoes of a young worker once again. So that's the latest piece of work that we're working on. But I'd like to leave you with just some questions before I finish up. And the questions that flow, I guess, from what I've talked about here is, can job quality be improved in the construction industry to reduce the exposure to psychosocial risk and its associated harms? How should construction organisations ensure that their workplaces are respectful and supportive? And can construction work processes be better designed to reduce work-related bodily pain and its associated effects on mental health? And lastly, if anyone's interested, we've got these 3 booklets which are quite short, and they're based on research that we've done, and they're available on the web. So if anybody wants to have a look at those, I can happily share them. But yeah, it sort of packages up some of the work I've just spoken about, and you can look at it in more detail. Thank you.
Thank you, Professor Lingard, for your presentation. I would now like to invite Chris Lockwood, National CEO of Mates in Construction, to present. Please join me in welcoming Chris.
Thank you very much for that. Trying to start my video, but it's not allowing me to do that, but that's okay. I can get the actual presentation going instead is probably a good thing to do. Hopefully everyone can actually see that well. Really pleased to be able to be here, and I'll try and be brief because I am conscious of time for everyone tonight, and give everyone a bit of an overview of how the MATES program actually works in the industry to address some of the issues and some of the problems that have actually been raised. And I'm conscious that, sorry about that. The presentation stopped. Let's bring that back up and hopefully share that again. Okay. The joys of technology. Is someone able to let me know if that can actually be seen? Try sharing it just as a standard PowerPoint window and work through it from there. This, I believe, will be being seen. And so the MATES program was established by the industry to address problems that were recognised that have been raised earlier in terms of actually the higher rates of suicide, and from the fact that we are talking about suicide today, it's important that if people actually do get triggered by any of the things that we're talking about here, that you contact someone who can help and support you. MATES has a 24/7 helpline, 1300 642 111, or Lifeline has standard contacts that people know. So I encourage everyone to reach out to help if any of the content that we're talking about today does trigger anyone. MATES was actually established by the industry about 15 years ago, and we're supported by both the employers and unions in the industry. So it's a whole of industry approach, specifically to work on suicide prevention in the construction industry. And the reality about why the MATES program was actually established comes back to an understanding of a broader sense of inclusivity across the industry, that we need to include an understanding of mental health and suicide prevention. And in terms of actually how we address what we're doing in the industry. Hello. And so the state of play when MATES actually started, we looked at the death rates in one of the redundancy funds over a year. There was 399 deaths in that year, and those on the board actually noticed that there was 88 of those deaths that were by suicide, and this was the first time that an industry specifically had been looked at to identify that there might be higher rates of suicide. And that industry redundancy fund decided that we should actually get some research done by Griffith University, the ASRAP Institute, to confirm the rates of suicide, to move beyond the anecdotal to the evidence-based. And that report by ASRAP is actually the foundation piece for the MATES program overall. And so I'll go through some of the stats that we actually built into the program to give everyone an understanding of how the program actually works in terms of raising awareness and then stepping people towards action. So we take people through some of the very core statistics, and some of them cut across things that people have already mentioned, but specifically the high levels of suicide in the industry make it understood that mental health really is a workplace health and safety issue. And from that ASRAP report, it actually showed that the rates of suicide in the industry is significantly higher than the general population. Where we can see female suicides were at the time when MATES was established about 4.1 deaths per 100,000. Construction accidents, which a lot of emphasis is actually put on, are about 6 per 100,000. Traffic accidents, 7.6. Male suicides across the broader population, 13.8. But at that time, what was found was that there were 40.3 for men working in construction, that the rates were 2.5 times greater than the general male working population, and even higher again for young workers. So that there really is a problem, and it's something that we need as an industry to step forward and deal with. And we know that from that report that of those workers that have died by suicide, that 1 in 2 had in some way, shape or form told someone before their death, and that only 7 out of 100 had actually sought any particular professional help before they died by suicide. So we realised there's a great opportunity to step in and actually do something, to connect people to the help that they actually need. And we take workers through an understanding of what we're actually looking for to help people understand when to step in, when to actually offer help. Because the MATES program is built around help offering rather than waiting for people to stick their hand up when they're struggling and seek help. And standard events, the people have been raised previously by Professor Lingard and Ms. Haong, in terms of the long working hours, some of the cultures and the bullying, they can have very distinct impacts on people in the industry. And most of these things are often about loss. And it's something that we can actually identify when we see someone actually struggling. And people might actually get to a bit of a tipping point. And if we saw someone struggling with boxes, we immediately step in to help them. And we raise awareness that it's the same when someone's struggling with personal issues. When they reach that tipping point, we've got the capacity to step in and offer help for someone. And the sorts of changes that people might actually see. Someone might become moody or numb or distant, or they could actually, their attitude could become more positive or more angry, or they could be giving away possessions, any changes in behaviour. It's just looking for those changes that's actually important. And we recognise that often it is a subtle gut feeling when you realise that someone's not in a good place and that you might need to step in and offer help. And what we actually let people know is that there is something there's a choice we all have. We can either do nothing or we can do something when we see someone struggling. And we know that when we did nothing, that it's not okay. The rates are too high in the industry. We all have a responsibility to step forward and do something. And in doing that, the reality is that if we actually look for the signs, and if we see something, we either tell someone, we can step in and actually make a change at that point rather than ignoring it. It's everybody's business. Suicide prevention, better mental health in the workplace is something that we can all have an impact on. And the role of a connector was actually established through the MATES program, built on the Living Works program, to allow people to develop the skills to actually connect someone to help in a safe way when they need it. And we encourage everyone who undergoes the MATES program. The MATES program rolls out across a workplace through a 45-minute to 1 hour presentation that goes through some of this material that I'm going through here. And we invite people out of that presentation to step forward and take on the role of a connector. And we generally get about 1 in 10 people out of each session that probably will nominate to actually step forward and take on the role of a connector, which is another 4 hours, half-day training for people to actually undertake so that they can have an active role as a volunteer in the workplace. And the way the role of the connector works is relatively simple. If we think about this as a standard workplace where we know that 1 in 20 workers may have suicidal thoughts at any point during a year, when you've got those the workplace around them, it's those workers, co-workers that are with someone every day that are in the best place to spot that you can actually see that someone is actually struggling. Instead of that person being by themselves, if we suddenly educate every one of them, we induct them all in the MATES program or another program that raises awareness, it means that they'll be surrounded by people on site that will have an awareness that this is an issue that can impact on all of us. It means that there will be someone there. It'll help someone to be able to notice that by building that sort of awareness across the broader workplace, it means it's something that we can all share in. And it only takes one of those workers to actually to notice something's actually going on and to step forward and offer help. And once there's actually a connector, that little green symbol there on one of the workers on site, all that's required is for that worker who noticed something wrong to go to that connector and say, I think you need to speak to my friend John or Bob or Janie over here because I've noticed this, this, and this about them, they're struggling. Or it might be that I go to my colleague and say, I think you should go talk to the connector because I've noticed you're actually struggling. I think it'd be worth you having a chat so they can connect you to the help that you might actually need. And the role of the connector is just to keep someone safe while connecting them to the help that they might actually need, not to replicate any services that already exist in the broader community. And the thing to understand out of this is that it's a very simple program at core, but it is about connecting people to the help that they actually need. And if we go back to that slide earlier on where we saw that only 7 out of 100 workers that had died by suicide in the construction industry had connected to the formal help and services that are available across the community, there is a massive opportunity for us to do a better job of connecting our colleagues to the help that they actually need. And if you think about that helmet sitting there by itself, someone's struggling with whatever issues might be going on at the moment. And we know that there are different services in society that potentially could help them in terms of, might be relationship counselling, legal assistance, help dealing with anger management or financial counselling. Diverse services that people might actually need to get them to a better place, but connecting them to the help is something that's missing, that has been missing traditionally. And by building the MATES program into the worksite, it creates a bridge that to allow that worker to be identified, for someone to step forward and offer the help that they might actually need, but to then connect them to those services by going to a connector who can then ensure that either through the MATES 1300 helpline or through services they already know about that are available in the community, they can actually help someone step forward to get the help they might need. And if someone is suicidal at that particular point in time, we also, every work site we believe should have someone that's assist trained available on it, so that someone who's trained in the assist program from Living Works as part of that MATES program or through Living Works directly has the skills to be able to keep someone not only safe, but to help take them to a path to create a safe plan to keep them safe ongoing. So the role of the assist worker is a little bit like, can be analogous to a first aid worker on site, but in terms of suicide prevention. By building that bridge to those services, we can actually ensure that people aren't by themselves on the workplace. Their mates can step forward and offer help when someone's actually struggling, and then connect them to the help that they actually need, that they weren't connected to before. And we want to know, the MATES program was rolled out, established 15 years ago, and it started in Brisbane and it's expanded more broadly across the country. Do we know as an industry, are we actually making a difference by doing something in this space? And to us, the MATES program was initially founded on a piece of research done through the Griffith University ASRAP Institute. And that has been built into the values of how we actually work to ensure that we do look to not only evaluate how the program is going, but to look to improve the program. And one of the bits of research which was done through the University of Queensland back in 2011 did specifically look at the actual tools within the program. And it really, that article, that published publication has shown that the program as it works, the tools within the program, they all have a role to actually play, that the tools do work. In terms of actually the impacts that reducing the level of suicide has. Another piece of work done through the Hunter Institute and the Central Queensland University, Professor Chris Doran did an economic analysis just to show that what the return on investment is for actually doing work in this space. And specifically, it showed with the MATES program that there is a return on investment of $4.60 for every dollar that's actually invested. And that only looks at the impacts across government services. That doesn't take into account the direct impacts across industry themselves, which is another piece of research we're doing at the moment. But there's significant returns on investment by stepping forward and doing the right thing in this space. So the evidence points to the fact that doing something does make a difference. And I know my colleague, Professor LaMontagne, will be speaking afterwards a bit more about the depth of evidence, some of the recent evidence that's shown up there, as well as I know what Professor Lingard was talking about before too, showing the importance of what we're doing, but also the fact that there is an opportunity to make a real difference. The World Health Organization recently, when they published a report called Live Life, which is a guide for countries that want to implement suicide prevention, did recognise that the MATES program is an example of best practice in a workplace intervention. When they wanted to exhibit what a workplace intervention looks like, it is the MATES program that they've highlighted in their guidelines for countries. So it's something that we as an industry can be proud of. The fact that that was established by the Australian construction industry, stepping forward to take ownership of a problem that is ours, and it's something that we can actually do something about. And to date, we've got to more than 270,000 workers face-to-face, and those connectors and assist trained volunteers, there's more than 25,000 of them across the country. And we all, through our case management services, when people need to be connected to the help and someone walk with them while they're accessing the services that they need, more than 12,000 workers have gone through those services. And the program has stepped forward into other industries in mining, energy, as well as New Zealand in the last couple of years, and a pilot underway in manufacturing at the moment, all stemming from the work that the construction industry has done to step forward and actually address the problem that we've recognised needs to be addressed. And the last thing I wanted to talk about, I know I've rushed through a lot there, but I particularly wanted to highlight that we do have a PhD scholarship program that we actively encourage people through the industry to think about stepping forward. If you've got any interest in actually stepping forward to actually take a deeper dive in terms of understanding what can be done and looking to do a PhD, there is a scholarship which is named in honour of our founding academic director, Alison Milner, who died tragically a few years ago, but her work to drive the underpinnings of understanding what we do in this space is phenomenal. And this PhD is to recognise the importance of her work and to bring it to life ongoing. So we encourage people to think about, if you're investigating the PhD scholarship, details will be coming out a little bit later on in the year. But if you are interested in that, I really do encourage you to touch base with MATES, because every year we want to get the best of the best to take on that scholarship, and it's handed out on an annual basis. At this point, I will stop speaking and being conscious of time, and will hand back to the room. And I apologise for the technical challenges in relation to this presentation, but I'm really keen to hear from Tony and any questions that follow thereafter.
Wonderful. Presentation, the MATES program, it's very eye-opening. I was quite interested in it. I think that we'll be looking to the future to have a bit more of a look at that. I think for workers, I think it could have a broad ongoing effect for many people in many different services and organisations. I would now like to invite Professor Tony LaMontagne, Professor of Work, Health and Wellbeing at Deakin University and National Academic Director at MATES in Construction, to present. Join me in welcoming Professor LaMontagne.
Oh, there it is. Thank you. Okay, thanks for the opportunity to speak tonight, and greetings to all our listeners, far and near. I'm a researcher, so I'm going to give a bit of a perspective on working with mates to try to achieve this little virtual cycle here. We want evidence that is useful to practice, but practice needs to tell us what evidence is needed, and that would ideally be reinforcing and leading to research that's useful and practical and makes a difference on the ground. So that's what we're aiming for, and I'll tell you a little bit about our journey and how we're trying to do this. There's a cast of thousands there to be acknowledged, including the academic reference group, which is 10 people around the country working in this area in OH&S and suicidology and related disciplines, as well as the MATE staff. Chris ticked off the first point there, just a little outline of what I'll present. So what I want to do is talk about why and how research is valued by mates, and then evolving collaborations and how it works, an overview of some of the research that's been done around the mates program, and an evolving research strategy that we're working on currently. So you've already seen, or Chris didn't show this slide, but these are mates pillars in their sort of strategic approach to the work, raising awareness, building strength, providing support, and informing it all with research. And that has been the case from the outset of mates in 2007. That research was central to their functioning. And that would obviously lead to evaluation evidence on what they're doing to try to improve it. But again, that virtuous cycle of research informing evidence and vice versa. Also mates is wishing to be a leader in research in the area, such that they can influence things such as research funding priorities and so on. And that would help spread the benefits more broadly. And then finally, having an ethos of publishing one's research openly can lift practice not just of mates, but of other people doing similar work around the world. And so this has really fostered a culture of evaluation and collaboration with researchers that's pretty unique and quite a privilege to be involved in. So this is a bit of a picture of how MATES sees research playing a role in progressing practice. As we do, let's see if I can get the little pointer to work. Oh yeah, there we go. As research results come around, you can better inform the different other pillars that we do. And with each spiral, as we go forward, we're using the research to improve the program step by step. So our research, the way we collaborate continues to evolve. So researchers and practitioners on the ground, they have different masters, they have different priorities and so on, but we also share common ground. Sometimes easier said than done, and that's why we say that we're working on improving it all the time. Our collaborations increasingly reflect the multidisciplinarity of this talk. Each of the previous speakers talked about the complex interface between life pressures and working conditions and economics and so on, COVID, pandemics and everything. And so we've got a whole range of disciplines represented on our research group. In 2012, this was established, and right now there's about 10 researchers you saw on the first slide. And in 2017, mates found that they needed to commit more strongly to this process by hiring a research manager who helps us to run that group, as well as to manage the scholarship that you heard about and other things. So the type of research that's been done on the MATES program, we divide roughly into 3 groups. Foundational research, such as the ASRA, the report that Chris discussed in the previous talk about documenting that there were elevated suicide rates in construction. And this provides, generally speaking, insights into the state of affairs that justify seeking funding for what we do, for example. Evaluation research is sort of self-evident. We look at what MATES does and evaluate its impacts, how it's implemented, and other things. Frontier research is trying to keep the program constantly evolving. And we'll give you some examples of these as we go forward. So foundational research provides the evidence of the need for the program, the relevance of it, and so on. This is one of the publications that Chris talked about in the previous one, showing some of the complex contributors to suicides in the building industry. You saw this in Chris's previous talk, and this is something that MATES commissions annually or every couple of years to track suicide rates in the sector and see how we're progressing at a global level across the country. And these things are, of course, essential in justifying the need for the program, as well as funding submissions. It accounts for nearly half of the research that was done when we did a stock take of publications a couple of years ago in 2021. Evaluation research provides evidence on the implementation and the effectiveness of the program. Here's a few examples without reading through them. But this is essential for continuing refinement and improvement of the program, as well as research funding submissions. It accounts for about 4 of every 10 publications that we have done, or MATES have done. And then frontier research is trying to be a leader, trying to find the thing that's coming up next. And it's strategically essential for program development and leadership, as well as for identifying new issues that are arising over time. And some examples here are work that MATES has done with showing very high prevalence of bullying in apprentices and the associated negative consequences of that. Tanya King and I, another member, talked about COVID-19 and suicide risk in the construction sector earlier in the pandemic. So it sort of makes trying to stay ahead of the game and opening new areas for work. This is the least common type of research that's done, but of course it's essential. And sometimes one piece of research covers 2 or 3 things. So in previous slides, we've talked about the widely cited figure of the suicide rate being twice in construction compared to other working males. And so we've been tracking this now for some years, and we actually have good news as opposed to all the doom and gloom that we've been talking about largely. And so we asked, are suicide rates among Australian construction workers changing over time? And we did a 20-year analysis that was published late last year. And sure enough, over that 20 years, the rate in male construction workers was twice of other male workers, but that's when you put the whole 20 years together. When we look at the changes in rates over time, what we see is some good news. We see that in construction workers, you see the initial big disparity. It's been coming down steadily over time. And it's changing more quickly than males in other occupations nationally. So that's good news. Why is this happening? This research doesn't answer that question. It would be attributable to a whole range of things, the whole totality of what's happening in the country. Employed males having a lower risk of mental illness and suicide, a healthy worker effect. Employed males benefiting more perhaps from mental health and suicide prevention services, because they were in greater need, perhaps. Population level mental health literacy, stigma reduction, including male-tailored programs such as like Beyond Blue and others. And then sector-specific suicide prevention, which is where MATES sits. The first substitute policy attention here was a 2003 Royal Commission, and MATES started around 2007. Nearly 1/3 reached so far across the country. And so the net effect of these interventions and others would account for this. We can't claim that's MATES, but we'd like to think that MATES is part of bringing those numbers down, and there's still a ways to go. Oh, come on, switch. So in short, MATES research activity is well established and growing, and we're developing a research strategy that would help us identify where we want to focus to identify emerging issues, frontier research, apply the MATES program logic to the body of research to gauge our strengths and identify where our gaps are. And I'll introduce you to the program logic in just a moment. And we also are out there with the sector, talking to people in the industry about what they think needs to be prioritized, what they need to know to improve their practice. And then finally, we're constantly trying to strengthen the dialogue between researchers and practitioners trying to sort of co-produce research, if you will, which is as many would see, the ideal version of the ideal state to be in, where research would actually be useful for improving conditions on the ground. So a program logic is simply an articulation of how a program is supposed to work. Chris talked a little bit about this in the previous slide, and then you hand it to a researcher and you get a complex spaghetti diagram, which I'll show you in just a moment. But basically you start with the resources that go into a program, the inputs, followed by the activities that the program implements. Those are our outputs. And finally, that should have an impact on certain outcomes in the near and longer term. And so this is the full and illegible version, which I'm going to zoom in just a moment. But in short, these are our inputs, these are our outputs, our activities. These are the impacts that we expect to happen in the short term, medium term, and the longer term. So this is available online, those who are interested in the details. This is a zoom in on the right side of that diagram. And you can see that here, the short-term sort of immediate outcomes we expect to see is improvements in things like mental health literacy, decreased stigma, increased help offering, and so on. And then the medium term, improved helping behaviors, and on the far side, lower distress in the sector, as well as lower suicide in the industry. And that's something we just saw displayed in the previous research slide. Oops, come on. There we go. And this is a bit of a heat map in terms of where we have focused our research so far. Lots around demonstrating to the industry that MATES is a go-to. Increased suicide prevention literacy, workers playing active role in the program. You saw the numbers that Chris projected in the previous talk. So I won't go through that in detail, but in short, you can see that there are other areas where we could do more research, such as workers finding ways to extend the MATES program on site, allowing workers to tailor the program to their particular site or circumstances, for example. And here's an example on the general awareness training, or the GAP training that Chris mentioned in the previous talk. This is about equipping all workers with basic awareness and how to refer people to a connector if and when the need comes along. And GAP's been shown to significantly improve suicide prevention literacy in construction, mining, and energy sector workers. However, most of the changes are small in magnitude. We'd like to try to improve that. Most evaluations are on pre versus immediately post-training surveys. We'd like to do more longitudinal research to see what the impacts are over time. Few with comparison or control groups in the early days. That's getting better now, but that improves our ability to, with control groups, we can improve our ability to attribute change to the program and not something else. And to date, there's been relatively little experimental research, but we've just published on a trial which showed improvements in intention to seek help from connectors and other workers on site. And we also are running a trial on the MATES in manufacturing pilot up in Sydney as we speak. So that's something that we're trying to address quite actively now. That's just a picture of the MATES survey form. So we also are out there trying to gauge what the sector wants, that is from people running projects, from field officers on the ground and others. The Blueprint for Better Mental Health was a collaborative project that was run by Alison Milner. And what this project did was it gathered a variety of stakeholders to try to take a big picture look into a roundtable and then to generate an industry-backed and government-supported roadmap for safer workplaces to pursue. Well, it's already 2022, and so it's time for a refresh of that soon. But these are the five areas that were identified by consensus through this multi-stakeholder group: promoting work's positive impact on mental health, reducing the harmful impacts of work, providing mental health and suicide prevention literacy, facilitating early intervention and treatment support, and providing return to work and ongoing support. And this is a bit of a heat map on the research, where research is focused to date in collaboration with MATES, mostly on providing mental health and suicide prevention literacy, because that's where MATES began. Facilitating early intervention and treatment, you've heard about extensively, and a little bit on reducing the harmful impacts of work. This is obviously a growth area. For example, bullying, job insecurity are key issues here, as you've heard about. But notably, there's relatively little on promoting work's positive impact. Helen talked about the fact that project work can be a positive experience, and I agree with that. And looking not just at the hazards and risks of this sector, but also where there's room to do work that is rewarding and well-being promoting. And then focusing a little bit more on return to work and ongoing support, that is return to work from a mental illness or from an injury that could also have an associated mental illness. And here's our sort of simplistic portrayal of how we try to do collaborative research to advance action in this area. We have industry relevant public health priorities that researchers can take on to some extent, conduct the research. The findings and communication, this part is quite important, where we forge the questions together, conduct the work, and then the translational activity, that is translating from research to policy and practice, is key, and that should feed into program development and then go around the loop. And theory, we're advancing practice and policy and reducing suicide risk for workers in the sector. How do we do this? Well, an example of this, research can be initiated by mates, by researchers, or by other stakeholders. And an example here is the Medical Research Future Fund's Million Minds Initiative, supported a large project led by Jane Kirkus at University of Melbourne. And MATES is a partner in this with a project that's run by myself on evaluating the impacts of the MATES in manufacturing pilot. Well, initially, MATES was really keen here on focusing that research on the connector role, better understanding what connectors do and how we can support them in that role. But in fact, what we required for the research was worker level outcomes. And so we resolved to conduct a cluster randomized trial on MATES program to address the gap in experimental evidence. So there has to be give and take. We can't have everything in one go, but that's just one example of how we negotiated the focus in that research. And we're evolving a process for supporting or collaborating on research. We're getting more and more approaches from external parties to do research with MATES. And this is quite important to question what the practice value is and the research value is, and involve both MATES and the research reference group in negotiating that space to try to advance things, do good research while at the same time research that's useful. So in summary, there's a strong body of MATES related research, and we're working on trying to make it better all the time. And we want to respond to existing gaps, which is why we've applied the program logic picture to it. We want the blueprint pillars to be strengthened, in particular those areas of gaps we identified. We want to follow a partnership approach wherever possible. And MATES is in the role of informing this with political strategy as an overlay. Researchers aren't so good in that space. So summing up then, this is my last slide. Over the last decades, the distinction between the researchers and the practitioners has blurred, and that's a good thing. We've co-produced a dynamic and continually evolving approach to collaboration, and there are positives here for all the stakeholders involved. And we seem to be moving towards evidence-informed practice and practice-informed evidence in a reinforcing cycle. So that's it from me. I just want to acknowledge Alison's memory. You've already heard about the Alison's Miller Scholarship. I'd just like to dedicate the talk to Alison. And there's some numbers to support for anyone who may have been a little bit distressed by the discussion of suicide in this talk. Thanks very much.